Everything that I know about ultrafine particles amounts to nothing.
About ultrafine particles?
Well, I know there's some ultrafine particles rolling around space.
Oh my god, I have no idea.
I know absolutely nothing about ultrafine particles.
And they're probably particles that are either extremely attractive or very small.
There were some really bad mistakes made when they built I-93 that we're still paying for in terms of people's health.
The people who live within 50 or 100 meters of the highway, those people have a uniquely high exposure to fresh mobile pollution that no one else in the same community has.
Hi, I'm Angie, and I've been working for the Main Turnpike for almost 24 years, and I love my job. The heat brings, a lot of the pollution levels down sometimes, but sometimes, the company will come by every couple of years and they put this little monitor on us and their little thing to breathe in, and so they test the air quality. I think they said the air quality was fair. When you've been here as long as I have, you learn that, fans do help keep the elements in the air out of the booth. Sometimes they don't. Like I say, catalytic converters break on vehicles. Yeah, you smell it. Tractor trailer trucks, cars, vans, they all overheat. You smell the brakes, but you just try to just keep doing your job. It doesn't really affect us in the ways that some people think it would.
I think most of the public is unaware of particulate matter as a serious concern. If you ask people about their environmental health concerns, I don't think most of them would say, oh, I'm concerned about particulate matter in the air.
The EPA regulates a suite of different air pollutants. We measure most of those, but they don't yet regulate UFP, which is ultrafine particles.
Ultrafine particles that are just one element in the emissions that come from car exhaust and truck exhaust and vehicle exhaust. And they're very tiny. They're so tiny that you could fit about 20,000 of them in a grain of salt.
What we know a lot about are the larger particles, which are the fine particles. For the ultrafines, which are the tiniest of the tiniest of the tiniest particles, we have much less of an idea. I'm currently the principal investigator on the core study, the main project for CAFE.
So CAFE stands for Community Assessment of Freeway Exposure and Health Study.
Our hypothesis is that the people who are more affected by ultrafine particles are the people who are living close to highways. So what we're trying to do is create an understanding of the pollution levels in a certain neighborhood.
When we first looked at the mortalities for all 351 cities and towns of Massachusetts, what we found was that in eastern Massachusetts, of the 100 cities and towns which surround Boston, that 14 of them had 75% of the excess mortality. And the map of the 14 communities looks like the regional transportation map.
We have a recreational vehicle that was torn apart and had all this instrumentation installed in it.
We've drilled through this thing in every which way. We have 2 generators that power the whole thing. It's been a process, a lot of hands-on, but it worked out well, and it's still, 3 years later, still functioning.
The RV does all of the mobile monitoring along neighborhoods that are close to the highways.
We started monitoring in Somerville, last year in Dorchester, South Boston, and then now in Chinatown and Malden. So these are our gas phase instruments, and then everything on this side does particles. The air comes into this instrument. This separates the particles into different sizes. Then it will send it in those ranges through to this instrument, which will then count the number of particles in different ranges. The reason we're looking at UFPs is because these particles, the smaller they are, the more harmful they can be.
So they're very sneaky. They can just bypass all of your natural protective mechanisms in your respiratory system, and even in the cell membranes. It's hypothesized that they can permeate and get into different parts of the system.
Is ultrafine particles an economic, environmental justice issue? Well, yeah. I mean, look where highways go. They don't go through Dover. They don't go through Wellesley. They go through Somerville. They go through the working class communities.
The way they literally put Interstate 93 in Somerville was they kind of unzipped a couple miles of blocks of very dense neighborhoods and took them out. They moved those people, and then they shoehorned the highway in. What that meant was the people who were left were really close to the highway.
We are at Mystic Housing. This is Somerville's largest public housing project, and then up above is Interstate 93, which carries over 150,000 people or vehicles in and out of Boston every day.
Mi nombre es María Guadalupe Ojeda, soy de México. Yo tengo 15 años viviendo aquí. Sí pasan carros que te sacan bastante humo, entra mucha tierra al apartamento, incluso en las mismas ventanas, no dura ni un día limpia, se ve ahí. Si te das cuenta, arañas, y luego más los polvitos. Imagínate, todo eso está súper sucio ahí. Y pienso yo que todo eso nos hace daño para nuestra salud.
We pay particular attention to Mystic Housing because it's got a population of concern. It's a vulnerable population. It's got some socioeconomic challenges. Some of the people here have health challenges.
Mis 3 hijos desafortunadamente tienen asma. El mayor tiene asma crónica.
My name is Moises. When I'm in my room, like when I'm sleeping, I always cough when my windows like open because of the cars, when there's a lot of smoke of the cars.
People think of air pollution and they think of respiratory disease, and they think of asthma in particular. And that's fine. Air pollution is associated with respiratory disease and with asthma, but it's much more strongly associated with cardiovascular disease, and most of the deaths, most of the mortality is due to cardiovascular impacts.
So this is the background site for Chinatown. This kind of gives a sense of what the regional air quality is. They also do blood tests and health surveys so they can compare the biomarkers to people who are constantly being exposed to near highway air pollution too.
呢個研究係好啊，呢個人人都需要，呢個社會需要，國家需要，環境需要，所以人人咧都話呢度好啊，空氣好啊咁，我根本覺得唔好。你好似而家咁，好似我哋呢度咁啦，你朝早抹乾淨啲玻璃，到晚黑翻嚟咧好多塵㗎。呢個應該有呢行路啊，有陣時咩呢 heat 啊，啲冷氣啊，你開咗嘅仲犀利。不論你 heat 又好冷氣又好，你開咗仲更加犀利。如果你唔開佢，一樣就吹得。
Often the homes that we're going into and where we're driving are of low socioeconomic status.
Those people are really paying the price for the rest of our convenience of getting in and out of the city by car. It's a very unfair distribution of benefits and cost.
Oh, definitivamente he pensado mudarme a otro lado, pero mis recursos económicos no me dan. De hecho, pues ha sido pues no es que realmente haya querido venirme a vivir aquí a los proyectos, pero no tenía otra opción porque las rentas afuera son muy caras.
你想都想唔到嘅啫，想有冇辦法實現咧？
I'm definitely proud of the work that I get to do as part of this study. I think it's really important because it affects people's health.
These neighborhoods, it would be great to help them in any way that we can, to support policy that would help them because they often lack that power.
The purpose for the research that's happening right now is to really build the case that this is something that's fallen through the cracks and that should be regulated and there should be standards for these particles.
Unless that you can really scientifically prove that the health risks are related to the transportation or whatever the factor might be, nothing legislatively will change.
We're midstream. We haven't finished our analysis yet, and so even the models of ultrafine air pollution near the highway are not done.
After CAFE, the next steps are going to be to try to figure out what can we do to mitigate these risks.
Just getting people to acknowledge that there is a problem. And that's, again, that is hard when it's something that is all around us, because we're used to thinking about environmental pollution as, this, we can react to this because we can see that, a stream coming out of the stack over there. We hear of sort of a crisis.
Unlike asthma, where people have an asthma attack and the kid goes to the hospital, if someone has a heart attack, people don't think about, oh, well, that might be because of air pollution.
Maybe we pay attention to where we place new pocket parks in the community, and we try to get those to be in places that are healthier. Maybe we pay attention to where people walk and bike.
But we should be pushing our government, our public agencies. They have got to start looking at the evidence. They have got to start acknowledging that these are huge health impacts and that it's not just the immediate downwind people. They get it the worst, but it's the rest of us as well. And I think it's something that can unite people of all economic backgrounds, all racial backgrounds, no matter where they live.
呢個擔心唔係我一個人嘅擔心，整體嘅人都擔心，唔係為咗一個人嘅問題，所有人嘅健康都有問題。